Well, I was very devastated and sad, and always asked myself, why her? Why was she, so unlucky and all this thing with her so many underlying conditions, and yet she has to, contracted this MRSA in the hospital.
Macam mana saya boleh dapat MRSA? Kerana hati saya sedih sangat.
Healthcare institutions worldwide face the problem of hospital-acquired infection. Infection control breaches result in transmission of viruses and bacteria that can cause disease. Failed hand hygiene practices are a major cause of transmission of MRSA, VRE and other multi-drug resistant bacteria. These infections can affect patients severely and in the worst cases cause death.
Healthcare workers are the main source of transmission of healthcare-associated infections from one patient to another. Without proper hand hygiene practices, other interventions for the prevention of infections are unlikely to be effective. Anyone can be a silent carrier without knowing it. There are no symptoms. You may become a silent carrier when you touch a contaminated item or come into contact with another carrier. The spread of infections can be transmitted by simply touching a patient or the patient's surroundings.
I'm Jennifer. My mother has been coming to the hospital regularly for her multiple medical conditions. She came in with a chest pain, so I think a day or two later, that's passed, around the cannula. Subsequently, she ran a fever above 38 degrees, so that she behaves very confused and hysterical at times. So the whole family members all rushed down to the hospital to see her, and we thought that she could not survive the night.
My name is Mr. Yahya bin Ali. My age 47 years old. Kerana saya masuk hospital kerana kaki saya bengkak, demam, bernanah. Itu sebab saya masuk hospital. Dah lama juga saya masuk hospital. Sebab ialah, lagipun saya dekat rumah saya demam panas. Saya tak boleh tahan. Lepas tu saya pergi hospital, pergi emergency room. Terus lepas tu doktor bilang saya nak kena operation, kata dia. Punca ni saya dengar mereka cakap pekerja-pekerja saya dapat MRSA. Itu yang saya dengar dari mereka. Saya macam terkejut kan. Saya macam tak percaya yang kaki saya bernanah kan. Saya bilang mana mungkin saya punya kaki bernanah. Tapi doktor bilang ini serius case. Dia bilang ini tak boleh main-main, kata dia. Perasaan saya sedih kerana saya takut kaki saya potong. Dan juga ialah perasaan saya macam sangat sedih. Saya tak mahu yang kaki saya potong kan. Itu saya tak boleh cakap. Macam nak nangis.
49-year-old Madam M had agreed to share her recent experience of an MRSA blood infection. She had fever and low blood pressure. She required intravenous fluids, antibiotics, inotropes, and surgeons had to drain her abscesses. Unfortunately, at the time of filming, she was readmitted to intensive care.
Healthcare workers and the community both play a part in preventing hospital-acquired infections.
The hospital has adopted several measures to stop the spread of healthcare-associated infections. Hospital staff are strongly encouraged to practice good hand hygiene. Hand hygiene audits are also conducted regularly. Alcohol hand rubs are placed at the foot of every bed and along common corridors for easy access. Patients are swabbed upon admission. The active surveillance program allows the MRSA patients to be cared for in a dedicated ward cubicle with contact precautions. The hospital also provides patient and visitor education on healthcare-associated infections and hand washing. Ward staff comply with a bare below elbow policy to reduce spread. Terminal cleaning is done for rooms that were occupied by infectious patients to maintain a clean environment.
Our patients come to us for help with their medical problems. As healthcare professionals, it's our responsibility to protect them against complications such as hospital-acquired infections. In this, hand hygiene is key.
I hope healthcare workers are more careful because there are consequences when a patient gets infected.
Sebab saya macam perasaan saya sedih sekali.